excited about this next conversation. I think healthcare is one of the most important issues facing our nation, and we have two great leaders in this policy arena to have a conversation about healthcare. That's Grace Marie Turner, who is the president of the Galen Institute. Thanks for coming, Grace Marie. And Katy Talento, who is a special assistant to the president for health policy, and she's at the White House on the Domestic Policy Council. So thank you both for coming.
Hi, everybody. Thank you very much for joining, and thank you for the Independent Women's Forum for sponsoring this important forum to really give you a good overview, I think. And I saw your program. My goodness, you really have the A-list of speakers here. And Katy Talento, I think, first among them. And she's incredibly accomplished. Katy is currently the Special Assistant to the President of the Domestic Policy Council. And when you hear her list of issue areas, you're going to wonder, what does anybody else at the White House do? She's in charge of health and social issues such as Obamacare, opioids, drug pricing, pro-life and religious liberty policy, and we are, as well as I said, as opioid policy, we're going to be talking about that today, and also a little bit about what's next with Obamacare. But let's talk about, first of all, and worked a number of jobs on Capitol Hill. She's worked for 5 U.S. senators, for several committees, and she's also done a lot of work in the nonprofit zone. She was a vice president for the Mosquito International, which really is a malaria protection and prevention for the workforce of energy companies operating in Africa and Asia. She's an epidemiologist by training, and has degrees from Harvard and University of Virginia, and has a real expertise in also AIDS policy. She worked with the Whitman Walker Clinic here, which is really the preeminent AIDS treatment and prevention clinic in the United States. So we are delighted to have Katy join us, and thank you for an incredibly difficult time. I know this is a difficult time to get away from the White House, but at least you just had to go across the street. So really, really pleased to have you here. So I want to talk a little bit. Let's start with opioid issues, because I know that's something that's been a serious concern of the president, something he heard about a lot when he was on the campaign trail. And of course, Katy has been with the president since the campaign, through the transition, and now since day one at the White House. So this is an issue that you've been dealing with a lot, and we'll talk to us a little bit about some of the president's initiatives.
Sure. Thank you so much, Grace Marie. It is an honor to be on a panel with you. Grace Marie has been a role model for quite a few years. Thank you. Yeah, so on the campaign trail, I mean, some of the swing states are sort of in that opioid-intensive area, in Appalachia, Ohio, New Hampshire, and West Virginia, Pennsylvania. So we heard a lot about this, and it was trickling up. This is a problem, I think, that has been building for decades. There's a great book if you want to learn everything you need to know about the opioids crisis called Galen. It's been on the New York Times bestseller list for a while, but it's basically described as a perfect storm of both the illicit activity in drug cartels from Mexico, China, and synthetic opioids and their importation of synthetic opioids, in addition to what was couched as a positive movement toward better pain management of patients and higher expectations around pain management of patients, which was going on in sort of the 90s with the increase, or the entrance to the market of sort of OxyContin and other types of pain management medications. This perfect storm just aligned to create the disaster that we are facing today, with over 100 people dying from overdose every day. And it kills more people in car accidents, kills more people than breast cancer. It's crazy. And I think every one of us knows somebody in our families or in our neighborhoods, in our networks, that has struggled either with a prescription drug addiction to opioids that started with prescription drugs, that maybe moved to street drugs, because that's what often happens. Prescription drugs are hard to keep going. People move to cheaper street drugs, and then it goes from there. And I think that the scariest thing that's really driving the increase in the epidemic is fentanyl. pharmaceutical use, and that's what complicates all of this, right? Is there are legitimate therapeutic uses for the opioids, including fentanyl, which is used in extreme pain situations like cancer or hospice care. And so it's just very complex to resolve. You know, you can't just come out with a Just Say No campaign when you just say no to a prescription your doctor's giving you. So the role of medical professionals and insurance payers, government payers in this crisis cannot be understated. And I think the president, he's had several speeches on this, but most recently announced his big opioid response plan. It centers primarily around we have three legs of the conservative stool. This is three legs of the opioid stool, I like to call it, in terms of prevention and treatment, which demand reduction, you don't want demand for the drug. Treatment and recovery, and then supply side, law enforcement and border interdiction, foreign interdiction, domestic interdiction efforts. So the Obama administration didn't prioritize all of those pieces, and as a result, I think we saw a lot of communities suffer that didn't have to have suffered as much. But we are basically, people are like, oh, you're only caring about law enforcement. You're just a bunch of jackbooted thugs. No, it's just that law enforcement was sort of neglected in the past, and so now we're giving it equal weight as the other two elements. But the other two elements are extremely important in terms of demand reduction, prevention of addiction, and also. But with prevention, again, it's very complicated messaging. So I think one of the game-changing elements of the president's plan is a safer prescribing initiative, and this means getting serious with doctors. And typically, conservative health policy, little Republican children don't grow up saying, we're going to tell you how to practice medicine. That's typically not what we do. But in this case, government policy has contributed to a lot of the problems here in terms of our lack of oversight. It's easier to pay for a prescription than an interdisciplinary pain management team. It's quicker, it makes the patient happier, faster than perhaps a 6-month physical therapy course. So we have contributed, and therefore we need to work with our provider community that we pay and we reimburse and that we employ, and we need to work with them. And so the president's basically set some really ambitious and outrageous, some have said, targets, such that 95% of government employed doctors or government reimbursed doctors, such as Medicare, Medicaid, TRICARE, are going to be prescribing opioids using best practices, hopefully as defined by the CDC, but that might take a while to get to, within 5 years, and within 3 years, 75% of them. So we have a huge data management problem ahead of us. We have tons of education outreach. We have reimbursement policy, regulatory initiatives we need to embark on because we control so much of the money in healthcare. And that means we have a huge responsibility to work on this issue. So that's where we are. It's big. So we're just beginning now that the rollout's done.
Well, and one of the things the president has talked about is really trying to reduce the demand side. Too many people that really felt just a complete lack of hope because the economy was so bad, particularly in these Rust Belt states that you talk about. And the tax reform initiative, the fact that employment is lower than it's been in I don't know how many decades, is also something that helps people, give people hope that there's a path forward to them so that they don't fall into these addiction practices.
Yeah, I mean, one of the things that we've been studying is the relationship between government disability programs and the opioid crisis and unemployment and economic status of an individual and a community. So I think the Council of Economic Advisors has done a little bit of work around this to try to show that, the disability programs have been part of the problem in terms of a lack of oversight and just letting people languish on disability, building and growing an opioid addiction, becoming more and more unemployable. Meanwhile, we bring manufacturing back into communities, and now we have employers telling us we have to waive drug tests. We don't know. We can't hire people. We have addiction problems, and so we have relationships going with some of these manufacturers and other industries to try to reintegrate people who've been on disability or in rehab or really in
One of the things that I see as a real theme of this administration is that you don't try to have sort of blanket government knows best solutions, that you really do try to study the problem, see what's really happening, what are the resources of government, but how can we engage communities and how can we look at some of the damage that government programs may be doing. So let's turn a little bit to talk about prescription drug prices, because I know that's an issue that people are very concerned with. And the Obama administration and too many of the others on the left believe that the answer is government price controls. The government just sets the price, then all of our problems will be over with prescription drugs.
Are you saying that's not going to work?
So, and the president's going to be giving a big speech on Friday, which is one of the reasons why it's so astonishing we have Katy with her here today, because that's a major effort in her space. But the Center for Medicare and Medicaid Services actually has already released some of its plans to help seniors with prescription drug prices in Medicare. They are going to be allowing, for example, certain generic drugs to be switched during the year, so that if somebody is in a health plan and there's a generic drug that may be less expensive, that could be changed during the year rather than having to go through all bureaucratic rigmarole to make that happen. And then also making sure, for example, that there are a greater number of pharmacies available, that Part D plans have a greater number of choices. But really, I see the theme of giving people more choices, energizing the competitive market, figuring out what the problems are, and helping to solve this problem in a realistic way that does not disincentivize companies from being able to produce the next generation of new drugs. So can you give us a little bit of a preview of the president's speech on Friday?
I would be killed if I didn't give away too much. Well, I don't want to speak for the president, but I think the role of government has been, again, cannot be understated in creating the problems that we see. And the layers upon layers of loopholes and special interests, and, the president has talked about this, but there is every special interest in this town has a piece of this problem, and they all blame each other for it, and they're not wrong. None of them are wrong, and so I think trying to take that on throws some orthodoxies up into the air, and I think
Something this good administration's good at, actually.
Yes. I mean, this is a fearless president, and he doesn't know or care how things have always been done, or why this loophole, or this special, or this carve out, and that. Like it's not like your typical Republican authorizing committee to protect, this model that they helped write for decades. And so I think it's going to be big, and I think there's no ox that won't be bored, if you will. I think the plan is going to be pretty historic, and it's going to take on every special interest, because everyone has been wetting their beak. Everyone has been benefiting except patients and the taxpayers. So that's probably all I can say. I'm sorry. I will get in big trouble if I say more.
Well, the lack of transparency is not only something that is a contributor to the problem, but something that consumers are angry about.
Totally.
They want to know why does this drug, a pharmacist, for example, may not be able to tell you that even though your co-payment for a drug is $40, you could get that exact same drug at Walmart for $4. And from their generic pricing problem. So those kinds of things that really work against the consumer, really, people need to understand and know what's going on. And one of the programs that I have studied for a long time, supported when it first was introduced, was the Medicare prescription drug Part D program, which is a model for how a government program should work. It is coming in at 45% under the expected spending for this program.
Wait, CBO got it wrong.
CBO got it wrong. Imagine that. Of course, that was Doug Holt-Sagan at the time.
Right.
And seniors' premiums were expected to be about $35 when this program was launched in 2006. They are under $35 today, 12 years later. So that kind of model, which was really, the Obama administration did everything it could to undermine it, is a model that shows that if you give consumers choice, if you have genuine competition in the marketplace, and the government has a light regulatory hand, the market can do a lot to solve these problems.
And seniors love their Part D plans, and there's a zillion of them in every community. And so, of course, that's exactly where Democrats went, was to try to cut off all these plans and private sector options like Medicare Advantage when they were writing Obamacare. They took on everything that's working, but which may lead us to the next topic, but I don't know. I think that drug pricing is part of the larger problem of lack of transparency generally, right? And my favorite story is that Speaker Ryan likes to tell is he had 3 kids who had their tonsils taken out, and he took them to the same place to have it done. It's the same procedure. They were about the same age when it happened, and it was totally different bills and totally different prices every time. And he looked at the bills and couldn't figure out my kid sat in a chair for 2 hours, he ate the Jell-O, like it was the exact same ritual, and it's a different price at the same hospital, the same procedure. So the transparency question in drug pricing is a problem, but it's part of a larger problem of lack of transparency. Nobody knows how much it's going to cost. That's why everyone's so terrified of losing their insurance, because it's the fear of the unknown. And until we get transparency, then asking consumers, as Republicans and conservatives have for so many years, to assume more first dollar exposure is too scary sometimes for the general public to accept. And I think that may be one of the reasons why we don't get as far as we'd like to in terms of really market-based health reforms that ensure more first dollar coverage, is because people are scared. They don't know what their costs are going to be, and they have no negotiating power around those costs. So we have to solve the transparency problem. We have to. It's indispensable.
And it really is part of this larger conversation. And we will turn now to what's next with Obamacare. Because, here we have Congress, members of Congress that ran for 4 election cycles on repealing and replacing Obamacare. And they went through heroics last year to try to they actually had 4 different viable bills, none of which were able to get all the way through Congress. The House did pass a bill, but the Senate failed twice. And so a lot of people, in fact, Katy and I are aware of an effort that's going on that is really going to give people, we think, more choice, more control, begin to get some more market forces going in the health sector. And it's a pretty bold effort that leadership in Congress is basically having post-traumatic stress disorder over what they went through last year with health reform. But there is an outside-in, bottom-up effort from people in the policy community that believe that we can, when Congress begins to feel enough heat, that they will come back to this issue. The president's budget actually had some verbiage in there about an approach that the White House could support that I think gives us a different way of thinking about health reform.
Yeah. So let us not forget that the House heroically passed a bill. And it was not easy. And I want to throw a shout out to all the moderate Republicans who took really hard votes. And we had our great friends on the right who held out as well. And I kept saying, you guys are in safe seats, come on! Our moderates are being heroic! And so at the end of the day, everyone came through, and I'm really proud of them. And we almost pulled it off in the Senate. So it was a little bit of a surprise that we did it. So I think a surprise to the leader as well. So I wouldn't call it a sort of catastrophic failure. I think we were close, and I would urge Congress not to grow some fortitude, y'all. I mean, we gotta not give up just because it was hard and we didn't quite make it over the finish line. That's just not how it works. I mean, I don't know how long it took for us to pass a partial birth abortion ban or welfare reform. I mean, sometimes you gotta come back. And so I hope that members of Congress don't, lose their spines of steel on this and regulatory approach, and that's up to them, and it should be up to them. So, there are some on the right that really just want to reduce the spending, and I don't know if that's possible. I think everyone would like to replace Obamacare. We've been there all along, but for now, just policy changes would be enough. Policy changes that would, remake our broken insurance system, and certainly our broken individual market, which is spiraling.
Well, the individual market actually has fewer people in it today than it did when Obamacare started in 2014. We are losing people, and guess why that is? The cost, the deductibles, the lack of limit. This insurance is just not worth it. People find the deductibles so high that they basically don't feel they can use their health insurance.
And so, don't have to, with the individual mandate, penalty review.
That's right. They don't have to purchase health insurance. That's right. And to that point, we've already started to see some news reports. I'm sure you saw them too. In Maryland, one carrier wants to increase its premiums for next year by 91%. 70-some% in Virginia. So we feel, and these are people who may wind up with only that carrier in their market. If they're eligible for an Obamacare subsidy, this is take it or leave it. Now, of course, if somebody's eligible for subsidies, the taxpayer picks up the bill. But that's not a solution. People really want real solutions over real time. And our health policy consensus group has actually been working hard ever since the clock ran out on the reconciliation bill on September 30th of last year, which was the vehicle through which Congress could have passed legislation with just 50 votes in the Senate, that we said, we can't give up. This is a real problem. We think members are going to actually feel the heat when they go back to their districts. The members want to talk about tax reform, which is great, but everybody else wants to talk about health reform. What are you going to do about my premiums? And so we've been working, and I think that we will be ready to announce this probably late May on a policy proposal that's getting a lot of interest from this traumatized Congress, but they may be more traumatized facing the voters in November without having done anything on this issue. So stay tuned, and I know the president, I know this separately, I did not hear this from Katy, but he does mention, members of Congress tell me that when they're talking to the president privately, he says, "What, can't you do something about Obamacare?" He really wants Congress to come back to this. And so the policy community, working with the Washington policy experts, a lot of experts in the state, people in the industry who have expertise in health savings accounts, and with a lot of activist groups who weren't really very enthusiastic about some of the bills that Congress was considering last time. This is a different approach, returning power and money to the states so that they can return choices to their citizens and give people more choices, just like the Part D program. If you have competition, more choices, then you can give people the kind of coverage that they want, so they will buy it and want to buy it because they can afford it and they like the policies, rather than having the federal government force them to buy it. So it's a very different approach. I think it's consistent with all the other things that the administration is talking about. Obviously, the White House is going to let us know what it thinks about our recommendations, but I think there's an openness to these ideas.
We are thrilled to have grassroots ideas coming and pressuring Congress. The president does not like not winning, so
Understatement.
he likes winning, and it's probably every time he talks to a member of Congress, like, how could you fail so bad? I didn't fail. Why did you fail? I suspect that's probably how it goes. I haven't actually heard those words, but I think that right after that same time period when the reconciliation bill went down in the fall was when we realized, legislation isn't happening. And so I will say that the president has taken pretty bold actions at an administrative level. We have some authority to do things through regulation and administrative guidances and that sort of thing to advance the ball. And so he issued an executive order in October, I believe, about Obamacare relief options. And so we have, I think, proposed 2 rules already around association health plans and potentially expanding who can participate in those. And we're hopeful struggling, drowning, dying out there in the individual market, and small businesses that have to pick between just not offering insurance and paying an employer mandate, or if they're small business, they might not have a mandate. But employers want to do right with their employees. They want to offer health insurance, and they haven't been able to, and it's so expensive. And they're just in the, they're in the car business, or they're in the roofing business, and they don't want to be in the healthcare business. So I hope that this will provide some options to employers that they haven't had yet. So to associate and to join together and get some of the benefits of bigger group coverage and bigger group pricing. So that's the plan on association health plans. We also, for people who are in between jobs, or for people who the exchanges are providing terrible value and plans can't afford or don't want, we put out a proposal for short-term, it's the worst branding ever, short-term limited duration insurance. I wanted to call them Obamacare relief plans, let me just for the record. But somehow short-term limited duration insurance, it's awful. So these are short, as they are called. They are short-term plans, and it used to be back in the day that you could buy these before Obamacare for up to a year. It was perfect for college kids in transition, or people between jobs, that sort of thing. And then, of course, once the exchanges took off and everyone's insurance premiums were going up, people were fleeing the exchanges to buy these plans. So the Obama administration had to put an end to that kind of freedom, and they cut down the amount of time that you could have on a plan to 3 months, which decimated the market for short-term plans, not as many people needed a 3-month plan. So we proposed, pursuant to the President's executive order, to reinstate the 12 months, along with some other reforms. But I think the comment period on that just closed as well, and so we'll hopefully be finalizing that rule and providing some real relief plans for people. They're not perfect. I mean, none of these plans, association health plans might not work for everybody. Short-term limited duration plans might not work for everybody. There are trade-offs for all of these different types of plans. What we needed was repeal or replace. So we still are calling on Congress to do their jobs and keep their promises.
Thanks so much, Katy. And actually, our Health Policy Consensus Group had 40 people. We hired a lawyer to write comments to support the administration's position and also allow those policies to be renewed. I hate that our time is up because we could keep going on forever, but it seems to me there's a theme here, Katy, and it is that the administration is really looking carefully at the problem. These are difficult problems that we have learned Washington cannot solve with a heavy hand, with more laws, more regulation, more spending. This really requires looking deeply at the problem, figuring out how we can be strategic and efficient about solutions, whether or not it's prescription drug pricing, whether or not it's opioids, whether or not it's overall Obamacare repeal and replace. How can we get markets to work better? How can we get people to have more choices? How can we help people help themselves? Exactly. That's right. So thank you, Katy, for coming here and for all you are doing to save our republic from the clinches of government-run healthcare. So thank you all very much.